You have to have courage to speak up on something that's uncomfortable or difficult, or you feel could potentially have impact on your learning development or career development. So I think courage is a very important character trait to speaking up.
The most important character trait for speaking up is courage, because you are making yourself vulnerable. It can go in either direction.
So I think the traits that help with speaking up, courage certainly is one. It takes some bravery to speak up, especially if you are feeling like a person who is not particularly empowered in that situation, or if you feel like you have something on the line in terms of evaluations or other things like that. So definitely bravery and courage.
One character trait that helps in speaking up, which is obvious, is courage. You need the courage to be able to speak up. But it's also important to have the practical wisdom, which is that skill that enables us to not just select which character strengths to employ in a given situation, but how to balance them. So if we only went with courage in speaking up, we might run roughshod over people, we might get angry at people, we might actually end up, in the name of speaking up and trying to create a psychologically safe environment, encountering something like a microaggression. If we only rely on courage, we might destroy the psychological safety in the clinical learning environment. So we need to have the practical wisdom to say, okay, speaking up requires not just courage, but equanimity, that even-keeledness to know, okay, I'm really riled up right now. I need to take a moment and check in on my emotions and not get angry and not take it out on this person that just did something that's wrong, but I need to speak up with courage and equanimity and compassion. And it's practical wisdom that allows us to identify those things and not just do the right thing in speaking up, but do it in the right way.
The most important things that a medical student can do is understand that they are a voice within the system that matters, and not being afraid to share that voice and create change, and having the motivation to create that change is something that needs to be there for there to even be something to happen. Without the confidence, courage, and awareness of a medical student being able to speak up, it's a non-starter.
Story about psychological safety in clinical environment. It reminds me of an incident that we had in one of the wards. One of my students brought up a thing that we were not thinking of. We had a patient with one condition, and we thought the subsequent conditions were the complication of the initial conditions, but the student brought up a totally new idea, and turned out that we were wrong and the student was right. So I think if the student didn't feel psychologically safe and didn't bring that up, then we might have missed something big.
So I think most people would say that courage is the necessary character trait to speaking up, and I certainly think it's important. Doing things even when you're afraid is key to speaking up in these situations. But I also think understanding our place in this in the healthcare system. Again, it is not about us. It's not about our grade. It's not about how other people view us as learners or as supervising attendings. It's about the patient.
It's really interesting to think about courage as not like a yes or no, on or off button, but finding your spot that you need to dial up to in order to kind of overcome that sort of level. It's easy for me to say, be courageous and speak up, but we also don't want to put people in harm's way by having them speak up in situations that have relatively low benefit and huge amounts of risk. And so it's a real fine-tuning situation to be in as a junior person on the power hierarchy, and we can really work on that as a team leader, setting expectations that we expect you will be speaking up, and that takes some of that level of dialing up out of that equation and helps people find that courage easier.
Courage is definitely the first thing that comes to mind. Students are often very afraid about what will happen if they speak up, and so having that internal belief that what you're doing is the right thing, I think is very important.